I've got two major points to make. Number one, to have the host of this forum, which we're delighted that you are willing to entertain this topic, have one of the most knowledgeable reporters in the state on this topic omit, when he gave an overview of mental health in Virginia, the epidemic and the crisis that's happening with addiction, which is a mental illness, and in fact, which is the most expensive untreated mental illness that we have. Says a lot about where we are in this community, about being willing to talk about an illness that is losing 10 people in Virginia a day. And just, grab hold of that figure. 10 people a day in Virginia are dying just from overdose deaths associated with heroin and opioids. 10 people a day. So that's not counting people like Gus Deeds. That's just from untreated certain types of addiction. And my second point is this, that we have a solution that's on the books. A federal law was passed in 2008 called the Mental Health Parity and Addiction Equity Act. Many of the people in the room have fought for 17 years to get this law passed. It requires health insurance companies and self-insured employers to treat mental health and addiction like they do any other medical condition that's covered by health insurance. And what that means is, you show up at a psych ward or you show up in an emergency room and you're told that you have to be homicidal or suicidal before you can get care for addiction, you're breaking the law in the state of Virginia, and the Department of Insurance needs to issue regulations or a bulletin or guidance that says that. They have the ability to levy fines against plans who commit these violations, $100 per member per day fine, and the state needs to enforce those laws. The private sector is shirking its responsibility for treating mentally ill people. We pay premiums for our insurance. Mental health and addiction services are part of that coverage. We now have a federal law that says that coverage must be available to people on par with the coverage for other medical conditions. And shame on us if we don't enforce that law that is on the books, that is ready and able to get people coverage today. Thank you.
Thank you.